Welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer Speaks. I am your host, Lori LeBay, and I'm thrilled you could be with us today. We are going to be talking with Dr. Anita Kumar, who is a geriatrician over in India. So we're going to learn about what dementia is like and geriatrics in general over there, how they're dealing with it, and how it's different from here in the US and other areas. You know, every city, county, country does things a little bit different. So I always find that really interesting. But before I introduce you to Dr. Kumar, I want to just do a shout out. June is Alzheimer's and Brain Health Awareness Month. And so help spread the word any way you can. One of the ways you can do that is like shows like this and others. Just spread the word, like, click, and share. I also want to give a shout out to Alzheimer Speaks, our free educational resource section. Please check that out. There's lots of great information for those diagnosed, their family and friends, as well as professionals there that you can utilize in many different fashions. And a big shout out to Twiddle. I don't know if you're familiar with Twiddle, but they have some great sensory products. If you have a loved one or a client who is, you know, kind of full of anxiety and anxious, they have these muffs that are just wonderful to kind of keep their hands busy and keep them comfortable during times of anxiety when a lot of times they don't know how to express it in other fashions. They also have a product called Adapt a Wrap, which is great because it can help with anxiety and frustration and sometimes anger and aggression that can occur sometimes during dressing with somebody. So not only is it warm and cozy, but it's something where they can't disrobe and they don't have to lift their arms up and, you know, kind of contort to get into their product as well. You can go to the number 4 and then twiddlesplural.com, 4twiddles.com to learn more information about that. With no further ado, let's talk with our guest today. So, Dr. Kumar, I'm so excited to have you with us today on the show. We've talked on and off for years via Facebook, you know, communicating and things. So, welcome to Alzheimer Speaks.
Thank you. Thank you very much.
If you don't mind, I'm going to have you introduce yourself to our audience. Tell us a little bit of background about yourself, if you don't mind.
So, I'm Dr. Anita Kumar. I'm a geriatrician by profession, and I did my MD geriatrics, that is MD, post-graduation in geriatrics. And post that, I managed the geriatric oncology clinic at Tata Memorial. I did a fellowship in geriatric oncology at the Tata Memorial Hospital, which is one of the biggest cancer hospitals in all of Asia. And it's one of the very good cancer hospitals as well. And then I joined Holy Family Hospital as a geriatrician. I'm currently a consultant geriatrician at Holy Family Hospital.
Wonderful. Thank you so much. You know, I always ask everyone who comes on if they've been personally touched in their own, you know, life and family and circle of friends by dementia. Have you?
Yes, actually, good question because my grandfather, towards the end of his lifetime, when he was affected by many other issues, but dementia was also a part of the problem. And as he grew older and towards the last 3 to 4 years of his life, he had definitely had dementia.
Okay, thank you. What made you decide to go into geriatrics? But actually, before that, I should probably have you define what the heck it is, because a lot of people don't even know what a geriatrician is. So let's start there, and then we'll talk about how you
I
got into
thought
it.
your audience would know a lot of about geriatrics because we say in India like we are not as developed as the American society or the UK society, etc. So we don't know much about it, and so we say that okay, they know much better, and we are learning from them and all those things. So I think they might probably know a lot about it as well. So anyway, geriatrics is the study of it's the gerontology is the study of aging, while geriatrics is the treatment of people who are older people. So basically, in India, our cutoff age is 60 years, but in many other countries, I think in America it is 70 years or something, and in the UK also it's 70 years, I think. And but as per WHO definition, it is 65 years of age. So basically, I treat all senior citizens, and that's how I tell my patients that I'm a doctor for the senior citizens.
See, and I think more people talk about the word senior than they do geriatrics or geriatrician. Plus, I don't know about over there, but over here we have very few of them. And so it's not something common that somebody asks for because it's we don't have a lot of them. So people don't know. And we still have that stigma over here about aging. Like I'm going to be 65 next week, and so I definitely fall into that range. And I don't necessarily want to think of myself as older, but I know I am. I can feel the differences in my body and how it reacts to things. So I think there's some of that denial, but I think some of it is the lack of numbers that are actually doing that job. And people are so used to going for a specialty if it's dementia or cancer or heart disease. I think they think more in the disease versus the age of themselves for the most part. So I think I know every country thinks the other guy's further ahead, but we're all behind when it comes to, in my opinion, in terms of communicating, what
Yes,
what the resources really
but
are.
India is moving very well. I think. I think the knowledge base and all is improving, is going very well. I think it's because of the technology and spread of knowledge, etc.
Well, that's good. What drew you to geriatrics?
Good question. What drew me to geriatrics? So I was initially I'll tell you, it's a little long story. So I did first my master's in biochemistry, post which I did a master's in international public health because I wanted to do something in health base. But I was in Australia and I realized I didn't want to pay my tax for a different country where, especially when it's not helping citizens of my country. So with all that patriotism, I decided to come back to India and uh, pursue medicine. So I entered medicine late in life. I know in the US it's probably not something unusual, but when I started medicine late in life, it was very unusual. It's quite unusual in was it quite unusual in my country. And so when I started medicine, and then slowly while I was doing medicine, I was drawn towards this. I'm born and brought up with my grandparents, and somehow their friends were my friends as well. So it could be I could relate to them so well. I could understand everything about them, and they could understand me. And there was a lovely camaraderie that I had with them. So in a way, I think I wanted to do something that dealt with the elderly, and slowly when I guess there was a time. In fact, when I was doing my medicine, there was no subject I remember as geriatrics in post graduation, and I didn't know what to do. So I had written a story on geriatrics, and I didn't even know that I will ever get into such a subject. But when I reached a point where I had to decide about my post graduation or what to do for post graduation, that time I saw this subject of geriatrics, and it was within seconds that I decided that okay, I need to do this. And that's how I took it up, and now life continues.
Okay, wonderful. Well, it's such a need for people to,
Yes.
to have somebody who understands the aging body and
Mm.
how we react different to medications or exercise, or I mean there's a zillion things, the foods we eat, our sleeping
Yeah,
habits, all of those things
it's
change.
yeah, it's a lot. It's a The geriatrics is like the full. It's got a huge amount of stuff in that. It's got a lot of scope, but we need to work because we are an aging population, not just in India, even in America. We are an aging population, so it's important that we work towards it and try to have more specialized doctors who can deal with the aging body.
Yeah, I know as I age, I get together with some girlfriends that I worked with like 40 years, well, 40 and 45 years ago. And we're at the age we're talking about our aches and our pains and different things that are happening to our body. It's like, what's going on, But none of us are a specialist in this area, but we're kind of sharing how our bodies have changed and how we react to things. And so I think it's important to have a doctor that understands those things too. I think that's really critical. So kudos for you for stepping into that space.
Thank you. Thank
Uh,
you.
as far as dementia goes over in India, what's the rate like over there? I mean, they're saying
So
here.
we are about I think 1.5 billion people in the country. You can take a deep breath there. 1.5 billion, and then about 8.8 million people are approximately are affected with dementia, and that's a huge. That's approximately 7% or something.
Okay. So let me ask you this because our numbers over here, we always throw these numbers out, but we also know there's a lot of people that aren't diagnosed, that aren't included
Yeah,
in
of
those
course, of
numbers.
course. Yeah, yeah.
Does stigma hold people back, or even just
Yes, yes. That
getting into
is
the
a
doctor?
problem. I go for so many lectures all around the country, and I talk to so many people, and that's the question they come up to me with. How do we break the stigma amongst the patients so that I can get the patient to the hospital? They don't believe, they forget, they don't believe that they are out of the way. They don't agree with what we say. But how do I get them to you? That is the first question.
Yeah, and I think in every single country, that's a struggle because the stigmas have been with us for so long and have been so negative. People, they're afraid of what's going to happen once they get that diagnosis, even though they know there might be help. It's all the other almost social ramifications and financial ramifications that, scare people. So
That's true.
again, I think that's another commonality that we all have with that. As far as knowledge of dementia itself, and there's many different types of diseases that fall under that
Dizzy.
category. um, finally here in the US, people are using the term dementia more than Alzheimer's. Initially everything was Alzheimer's disease. And
Yeah,
so they're
yeah.
starting to learn more about
About
dementia,
dementia.
and yet they still get confused. They think everything,
Everything is, yeah, most people here interchange dementia and Alzheimer's. They think Alzheimer's and dementia is the same thing. So the words are the same. They don't understand that dementia is an umbrella term used for many other types of, the many other diseases fall under dementia, and just. So yeah, a lot of whenever I go for talks, and this is a common question that is asked. I mean, I love to address the common man because I love to educate the common man about various aspects of geriatric care. And this is one of the aspects that is dementia. And I have to literally tell everyone from the basics as to what is dementia. And under dementia, we have Alzheimer's, vascular dementia, Lewy body dementia, and various other dementias. So Alzheimer's is only one type, but but I don't know. Even today, actually, a lot of people even don't know the word dementia. Also, they're very confused. But the newer, I'm talking about the older generation, but the newer generation of people, they are aware of it. They see articles on the paper or in the news or online, and they tell me, ask me, every other article online nowadays I see is on dementia. What is so special about dementia, and why is it so big now? We have never heard it before. When we were children, we have never heard of this word, but now it has become very big, and everyone seems to be knowing about it. Yeah, because I guess technology has taken over, and has created greater awareness among people. And besides, basically, people are living longer, and age is one of the biggest risk factors also for dementia. So, so that's why we get to know more about it.
Now, over here, they're starting to use the word neurodiverse, or, they keep changing the terms, which I don't think is helping the public at all in terms of understanding what is going on.
You
And
just
I
have
know,
to be simple.
yeah, yeah. So I've been really trying to hold more to dementia, and I'm starting to educate people on neurodiverse and what does that mean. And it opens the door a little bit wider. And some people don't like the word dementia because people take it as being demented. And again, I think that is all on how do we educate people. I just think there's such a big importance, like what you had said earlier, of talking to the common person on the streets, using the language they know to understand things instead of twisting things constantly. I feel like it's the dice game, where's the dice under which cup, and we keep moving it around all the time. And that's not helping their stress levels, in understanding
That's
how
a
to
big
care.
problem. So when I go to, so I do house visits as well, which means I go to whenever there is a patient who wants a house visit, they call me up and I go to their house and see them. I don't know what they call it in America, or does such a system occur in America? I doubt that. Do they have house visits?
We don't do much for house calls. There's a few. Our like communities now have doctors that they hire to come into a community where someone's living, but we don't see a ton of house calls. Our house calls are going to be telehealth, typically most of the time. But yeah, there's very, very few that you hear actually go
Yeah,
into the
so I what I do is house call, and it is a beautiful system, as a geriatrician. It is so beautiful because most people that I 95% of the people that I see in house calls are bedridden. So it is very beautiful to go and see them at their house, to treat them at their house. Of course, we don't do any invasive procedures because that is unethical. So we try to do as much as we can in the available space and time that the patient has for these patients. And a lot of them are dementia patients, so they don't understand anything. They are just they are just doing their living their own lives, but they don't understand anything about what is going on. The family is only helping them live their life on a day-to-day basis.
Well, that's nice that you can go into the house like that. And I
Yeah,
would imagine
that's a
going.
beautiful system. I think I wish it was there all over the world.
Yeah, well, and it gives you a whole different insight of, the
Exactly.
living dynamics, who they're
Exactly.
living with, what their living environment is, because a lot
Yeah.
of times people aren't honest about those things.
Yes,
That
yes.
has an
And you
impact on
see
their
that
health.
honesty in their eyes. A lot of times you also see how, if they are telling a lie, or if they are trying to hide something, and that you can see very clearly. I mean, you don't have to, there's nothing much to hide.
Well, I can imagine how helpful that is, but what a relief to not have to get someone who's bedridden, to a doctor's appointment and things too. That is just a task and a half in and of itself. And the stress. I remember my mom lived with dementia for 30 years. And for a long time, she was really good about doctor's appointments because she, in her life, she always made sure she got her annual physicals and went to the dentist and had her mammograms. And I mean, all of those things were just part of who she was. And then when she was living in a community, and I would, pick her up to bring her to those doctor's appointments again. In the beginning, it was fine, but as things progressed, then she thought, "What's wrong with me?" and she would get really nervous. So I couldn't tell her like a week before or 2 days before. I would just have to come and pick her up and bring her because the anxiety level of not understanding all of that was just through the roof with her.
It's actually great what you're saying. That's because you have respite care facilities in your country, and you have a place, a home to keep Alzheimer's patients. But in India, we do not have those things as yet. I mean, it's developing. I won't say it is very developed. It is still in the developing phase for homes and for having respite care facilities. It's still not up there. It's not up to the mark, but we are still developing. A lot of companies are coming up. A lot of startups are starting in this aspect. So let's hope and be positive.
Yep. Yeah, it is. It can be really helpful. I know here in the US, a lot of people are pulling back ever since COVID in terms of placing people in communities because the whole COVID scenario where people couldn't see their loved ones really scared them. But now we are seeing just the spike in cost, and people I can't afford this. And so even if they want care, if it's respite care, maybe through an adult day program, most of those have gone out of business, and they're not there anymore to refer people to, or they have cut back their hours significantly. Like a lot of them are only 3 hours now. Well, by the time a family drops somebody off and goes to go shopping, they're turning around and rushing to get back to pick them up. So it's not relaxing. It's just kind of another thing. So in my support groups, I hear often that, well, I just don't do it because it's too stressful. And the adult days used to do showers and cut toenails, and they're not doing any of those types of things for them that were really, really helpful to the families. Do you have adult day? I know you said you don't really have a lot of communities for memory care, but do you have adult day where people can drop them off and they can be entertained and engaged?
I think there are few, but they're very, very few. I mean, I cannot think of much. I think I don't know, but
Yeah.
honestly, that thought process is still not started in India, and or rather, it is very slow. We need many startups in that area to manage. So it might come there soon. Maybe another 10 years, we should be there, but
Mhm.
not yet.
Do you have like social programs you can refer people with dementia and their families to, like
Yeah, so there
Geriatric?
are there are some organizations who do it. There are multiple organizations rather who have social programs for dementia care patients, and they involve the elderly in activities, certain activities for mental activities, physical activities, whatever they can. But frankly, this where I stay, Bombay, is just one of the cities in India, and it is so widespread. The areas are so wide, it's very difficult for people to travel from one side to the other side also. So so that's why whenever you need to have small areas or small programs, but that is not possible, and it's not yet happening. Just
Oh,
there are just maybe three or four programs or social programs that I know of, and they do it regularly. Otherwise, not many do.
so getting back to being a geriatrician, is that a common phrase that people understand and know? Nope.
Nope, nope. People don't understand what a geriatrician is, and I have to explain that to them. But that is fine. It's not just about we are talking. I'm talking even about the educated class who's well educated. Even they do not know what a geriatrician is. For example, I spoke to a man from the press a couple of months ago, and he is. If you say you're from the press, obviously you're well aware of a lot of things. I didn't know that he was not aware of the meaning of geriatrics. He asked me what is the meaning of it. If he doesn't know, I can imagine a huge proportion of people will not know what is geriatrics, which is why my aim is to even educate people about geriatrics and educate them what how we are involved in the society and how we can make a difference to the elderly of our society.
So how do people get referred to you? Do they get referred to you from other doctors then?
Yes, that is one of the ways. Also, my cards are out there. The hospital also promotes to some extent, and also we do some programs here and there in the around the hospital. So that's how people get to know, and then it's a word of mouth that matters.
Okay. Are there very many of you in India?
No, no, not at all, not at all.
Wow. It's just so sad because all over the world, I mean, our population is aging and it's like, how did we not know this ahead of time to have enough professionals
In fact, I wish we had the government put in more effort in educating the people about geriatric care per se, and not only mine, all everybody all over the world, and so that we can really provide good care for these people. It doesn't, and it is possible. It is very much possible. I just need support from various places. That's all.
not only does it help the patient but the family, because a lot of times the families don't feel like the doctors really have a bedside manner, or they're not really understanding what is going on, and they're not being heard. It's like, well, no, this is what's happening, and they kind of feel like it's blown off. They're not really taken seriously, and I would see that would make a big difference there. Now, one of the problems we have here in the States is the doctors have like 15 minutes to talk to you, and that's it, and it's this, kind of conveyor belt of getting patients
Yeah,
with
yeah,
our
yeah. And
insurance.
that is what is so different about geriatricians. I don't know how the geriatricians in America are, but in India, at least, the geriatricians are trained to give time to their patients. So you won't believe, but I take at least 25 minutes with one patient. And it's not about me just knowing the patient from the health perspective. I get to know about the patient from their family perspective, from their backgrounds, what they like to do, what they don't like to do, what is depressing them, what is making them happy, and a lot of other allied things apart from the health aspect also, which makes it very different, which makes it more a one-to-one personal communication, and you feel the patient feels very happy. Invariably, the people who go out of my clinic are very happy because they feel that they've had a good conversation
Yeah.
irrespective of what their issue is.
Well, it makes a big difference when you feel heard and understood,
Yeah,
versus going somewhere else, or people can feel that rush of time. We've got to
yeah,
get through it. And when we're dealing with our elders, and this doesn't apply to everyone, but many need a little more time to process things. They
yes.
learn things
They
differently.
have to remember. It takes time to remember that, oh, this is the problem, this is the problem. So then when they just keep trying to, and by the end of my conversation or the discussion, they will again remember, oh, I remember this is also a problem, can you please tell me what to do? So then I have to change certain things and alter certain things and see what can be done.
Yeah. And I don't see this here in the US, and it drives me crazy because when I was dealing with my mom, I felt like I had to figure out my communication system with my doctor because there wasn't time in our appointments to address all that stuff. I needed to get that information to them ahead of time. Do you guys have a system where families can, submit an email and have something, for the doctor to be able to review prior to walking in the door?
There is a system, but it's actually just yeah, we do have an email, and if up till now I've not had such chance, but people do send me their reports beforehand on the mobile phone, on the WhatsApp or whatever phone. They send me the reports, and so that I can review the reports, and when they come in the second time, then I at least know the reports, and it doesn't take long for me to then tell them this is your prescription and these are the things you need to do.
Okay, because I always found, because a lot of times with dementia, there can be tough conversations. It could be driving, it could be all different kinds of things. And it's like, I wanted the doctor to be able to address that ahead of time. But sometimes, as a family member visiting with them, you can't really bring that up.
The
Or,
caregiver burden is huge with dementia patients. Actually. That is the biggest because the patient doesn't know anything. They don't know what is happening. So it's the caregiver who is mostly stressed.
yeah,
And they also need counseling.
I agree. Well, I want to just take a brief break and we're going to come back and pick up about the kind of caregiver burden and how families are dealing and coping with this along with person with dementia. We have been talking with Dr. Anita Kumar over in India, and she is a geriatrician. So she helps our elder population. That's, really her specialty. And there's not a lot of these positions really around the world, not near enough of them. So it's been fascinating. You can reach her by email, Facebook, YouTube, LinkedIn, and Instagram. We'll have all that in the show notes for you. And she also communicates regarding is it WhatsApp? Is that what it's called?
Yes, WhatsApp.
Things. We're going to hear about Q for Good, and we will be right back. I also want to introduce you all to Q Blocks. They have been absolutely excellent to deal with. They have been in business for 18 years and they serve the globe. I can't say enough good things about this company. I've had a lot of bad experiences. I don't know about you with tech companies. They have made a very complicated process very easy. And their staff is so kind, so polite, so respectful to work with. And, when I am frustrated and ready to pull my hair out, they just smile and tell me everything's going to be okay. And they really are just on top of the communication, which alleviates so much stress as an owner when you're dealing with tech issues. You can get a 10% discount. Visit them at Q Blocks at CUEBLOCKS.com, or you can email them at letstalk@qblocks.com. For that 10% discount, just put Lori, Lori, in the inquiry form. And again, I don't think you'll be disappointed. I surely haven't been. I can't rave enough about this company. And that's kind of rare these days. Dr. Kumar, I really want to talk more about the burden on the families. And, here in the US, people are complaining about it all the time. And yet we have communities. It sounds like we probably have more programs and people are still screaming it's not enough. I can't even imagine what people over in India are saying. And
You would be surprised that India has a good support system generally. The families in India, even though they are nuclear compared to before, if you compare ourselves with America or UK, I think we are still having a good network within the family. So there is generally someone to help, but I will say that is deteriorating with time, and we are getting into the nuclear family mode just like you. And we are probably the family system is deteriorating in India. So maybe in the future, we will not like if I had to have dementia, maybe I would be very worried. So, yeah, that's the, I mean, with the deteriorating family system and structure, we will need more help from the outside to support dementia patients.
Yeah, I've always found it interesting the cultural differences in terms of how we care for our loved ones or don't. Throughout the world, it's very very interesting. With my mom, our goal was always to keep her home with me, and then my dad got sick and he had to move into a nursing home. He was not able to live independently or with us due to his brain cancer. And my mom actually asked to move in to the nursing home, which is totally unheard of. No one typically asked for that, but she wanted to be with my dad. And so she moved there probably earlier than what any of us were thinking, but she needed that for her quality of life, to be able to spend as much time with him, as she could. And she qualified. I mean, it was she was high need at that time as well. So it was nice for us as a family to even have that option, to be able to look at. What are some of the scenarios that you see families struggling with?
What do you mean? What kind of scenario?
Like different experiences, what frustrates them or brings them joy. I would imagine you hear
Yeah.
lots of different stories from people,
Okay. Okay.
and needs and
So
wants.
there are some patients who are very agitated and some patients who are very subdued. The subdued ones are good. They are very easy to manage and no problem. The agitated ones who continuously walk around, who continuously are wondering have they had the food or they've forgotten to have the food, and just after 2 minutes they start to say, "Oh, I forgot. I have not eaten food, and these people are not providing me food." And this is very common. I've seen in patients where they forget that they have eaten food, but all around the world they go and say that my children have not provided me food. See what kind of children I have, when they have actually just eaten their food. Then there was one another case where I remember the patient would have just had food, but as soon as any guests come home, they will start eating paper, and they would tell everybody that these people are not providing me food, so I'm eating paper. So that because they don't understand, right?
Mhm.
So that was a very interesting case. Otherwise, there some patients are very aggressive with their behavior. They will not listen to their caregiver. They feel that they have been misled by their caregiver. Many of their patients will say that my money has been stolen by my children, and I am living alone. These people have taken away my money. I don't have any money. They have stolen my money. So those kind of things happen.
Yeah, the paranoid state. I remember my mom, she wouldn't let anybody in her kitchen. It was only me. So we'd go up to the lake and I would cook and clean for, a week or the weekend, and everyone else is out on the lake and water skiing and having fun. And I was just cooking and cleaning for 30 people because she wouldn't let anybody else in her kitchen. But that kept her calm. And she had lost trust and things with that. We also ran into, not just the paranoia, that, the stealing, like you said, is really common, or feeling like they're taken advantage of, because they don't understand that their skill sets have changed. Do
Also,
you?
one patient, there was a question of driving. I
Mhm.
mean, they were not the male patient was a drive. He used to drive, and he didn't want to give up driving. But the relatives wanted to uh, convince the patient that you should stop driving. You are causing difficulty for others, and you're unsafe on the roads as well. And they were trying to ask me, how do I convince them, etc.
Yeah. What did you suggest to help them through that process? Because that is such an individualized.
It's very personal approach. It was a difficult case to explain to him, but firstly I did not tell him to stop driving immediately. It was a slow process. I was just trying to explain and telling him how he's forgetting things and he has to be a little careful with these things, but it was over several sessions that he understood himself.
I know over here we have a lot of people with dementia talk about that early on, and many of them have written letters to themselves and their family when they still understand that there could be a danger in the future. And some of them have done videos like this, and they said, "I know that I might not remember saying this, but I want to remove your guilt, because I know you're going to feel guilty, and I know I may say some things that are really mean, but I want you to know that when I had all of my mind and could process, that I did agree with this decision." And it gives the people with dementia some comfort that they're being proactive to help their loved ones in the future with some of those tough decisions. And many of them would say when they didn't feel that it was safe to maybe have their grandkids in the car, that was the time to take the keys away. Because they didn't really, they said, well, they weren't so worried about themselves, but they didn't want to bring harm to somebody that they loved. And so their grandkids were kind of that waypoint of, okay, this isn't safe now, for me to be driving. I know I was lucky with my mom. She just kind of stopped driving. She didn't drive at night and then didn't want to drive when it was busy. I think she was seeing some of the changes in herself, and so she just, without words, just kind of pulled back and
It's a
didn't.
question of luck. If they listen to you, that's great. If they don't, that's also very bad.
Yep, yep. And a lot of us think that, well, the doctor will tell them, and some of them will listen to the doctor, but some won't, and a lot of that, I think, and this is my personal opinion, and I'm not a medical professional, but I think a lot of that is just general personality and not even the dementia. Did they listen to other people before the dementia? Some people never ever have, and they've always,
Stubborn. They say as you grow older, you grow stubborn.
yeah, yeah, yeah. The traits that you have become stronger, and I've seen that over and over, and I see it with myself too. As I age, I so yeah, my daughter's gonna have her hands full with me. What about like Lewy body and hallucinations or frontal temporal lobe with personality changes? Have you had families dealing with those two things? Because they
Not much, not much, not very common.
okay, so that's lucky because I know, with Lewy body and the hallucinations, that can just be devastating to people, and sleep patterns and are broken and no one's sleeping, and safety issues can
Yeah,
come about.
that is there, but very few, very few.
Okay,
Actually, in India also, we do not get an appropriate diagnosis also.
okay.
Very few patients get like a proper diagnosis. So it it's kind of tough to say which aspect they fall into.
Yeah, and that's still here too. Not that that's comforting to hear, but most people say it's several years to get a diagnosis. Most of them will say it's anywhere from I would say 2 to 4. Some will say 2 to 5 years to get a actual diagnosis because they're going down, well, you're depressed or you're this or you're that, trying to sort some of those things out. But then what we're running into over here is the change of diagnose. So, everyone was diagnosed initially with Alzheimer's disease. Well, then all of a sudden, the rules changed, and then they said, no, you don't have Alzheimer's, you have MCI or mild cognitive impairment. And they would go, there's nothing mild about this. My symptoms haven't changed. And they got really mad with that terminology and really upset and felt like there was even less support for them. And yet nothing had changed, in terms of what was going on. And then from there, people will get maybe a Parkinson's or a Lewy body. And then all of a sudden they have 2 or 3, and then it changes again. And now they're like, well, we're not sure. But you have some form of dementia. And so um, I think what we're hearing more here in the US is people are understanding one diagnosis doesn't always stick, and to be prepared for changes, because no one was preparing people that a diagnosis would change. And so that was really a big slap in the face, and families and patients were like, what do you mean now I have to start all over again? So what I am seeing on a ground level is that people are sharing their stories more, and so they're learning to be prepared for a change in diagnosis, not from their doctors, but from people in their support group, so it doesn't take them back. And I think it's also urging them to look at the similarities between all of the dementias, and get more educated, because they don't know what's coming down the pike. with that. So it's a complicated disease, that's for sure. That is for sure. Um, Now, how about like employers and stuff? How are they dealing with this? Like, people who have like early onset, sometimes try to hide it and they want to keep their.
Yeah, I haven't seen early onset dementia because I see only people above the age of 60 and
Mhm.
um, yeah, so most of them, most of my patients are like that. So
Okay.
they are usually not working.
Okay. Because, even over here, we're seeing people working later in life and they want to continue, because that's their life's purpose. And not all companies are in agreement with
Yeah,
allowing that or adjusting
yeah.
for that. So, in wrapping up, again, thank you so much, Dr. Anita Kumar, over in India, who's a geriatrician. This has just been a lovely conversation. I've learned a lot, which I always do with my guests, and I hope that you have too. I always like to ask our audience to be a giver of hope. You like, click, and share this episode because everybody can learn from this conversation. If you know people over in India or not. It just shows how much we are more alike than different in all over the world and how big this need is and how important it is to share our stories so that people can get educated. And again, it takes no money, it takes very little time, but it can really have a big impact. So please feel free to share and become part of our community. And again, in the show notes, you can find all of her contact information from Facebook and YouTube and LinkedIn and Instagram and the WhatsApp, as well as her email. So again, thank you, Dr. Kumar, for spending time with us. This was really well spent time, I believe. Thank you.
Thank you.
So, one last thing, I always like to encourage people again to go to alzheimersspeaks.com, check out all of our free educational resources. From there, you can also find Dementia Map, which is our global resource directory. And feel free to peruse all of those things. They're all free to use. And if you'd like to become a member of Dementia Map, if you are a vendor and have a product, service, or tool, you can easily sign up for that. You can reach out to me directly to get a tour, or you can just go in and sign up. We have both free and fee based plans there. So thank you again, everyone. Have a great week. Bye bye.